Hey everyone, it's SamaKaze back here with another video. Today we're going to be looking at the recent Lindsay, what's it? Lindsay, what? Lindsay Clancy trial. Yeah, that's it. Took me a minute. You kind of don't want to remember that name after all this has gone on. So we're watching the recap from this one channel called I'm Not a Lawyer, But, and it's the first 10 days of the Lindsay Clancy trial. So I'm going to go through this. I'm going to see what the heck is up. I'm going to talk about it. I'm going to give my viewpoint. We're probably going to end up being very disturbed and very disappointed in both the system as well as the people involved. But, you know, that's bog standard at this point with the American dream and the American nation. So let's just get into this, shall we?
A lawyer, but let's talk about this Lindsay Clancy trial and everything we've learned from day 1 through day 10, because there's a lot going on.
Of course there is.
Some of this will be repetitive, especially if you've been following the trial or if you watched my first video, but I think it's important that we start at the beginning so that we're all clear on the timeline.
Sure.
So, this is Lindsay Clancy, and on January 24th, 2023, she asked her husband, Patrick Clancy, to go pick up takeout.
Oh, gosh. This guy looks like he's absolutely hit rock bottom. I mean, he's lost his 3 kids. He's lost his wife to madness and to her decisions, and it's just it breaks your heart to know what the heck has happened to him, and that's just the surface level stuff that I know. Who knows how deep this rabbit hole goes?
Out for dinner while she stayed home with their 3 kids. 5-year-old.
Oh no. They were such sweethearts, I'm sure, and yet now they're gone.
Cora, 3-year-old Dawson, and 8-month-old Callan.
An 8-month, oh my gosh. An 8-month-old child. What the heck is wrong with you, lady? What? Okay, we'll find out.
Now, right before Patrick leaves the house, Lindsay asks him to also stop by CVS to get some stool softener for their oldest, who hadn't been feeling well. So Patrick leaves the house and makes the first stop at CVS. But because he was unsure of what brand stool softener to buy, he gives Lindsay a call.
It was very brief. I just said, I think there was a generic brand, and I said, is this one okay? And she said, yeah, that's fine.
Yeah.
And what was her demeanor during the call?
She was pretty quiet. It sounded like she was busy. I remember hanging up thinking she's probably in the middle of giving baths or something like that.
So
oh
it
my
sounded to you
gosh.
like she was in the middle of something?
Yeah.
From there,
she was in the middle of
the
something. Oh
restaurant to
my
grab
gosh.
food. And then he heads home. And when he gets home, he notices that the house is eerily quiet.
Yeah.
I called down in the basement and no one answered. I started checking upstairs. First, the bathroom. I thought maybe they were taking baths, but there's no one there.
And then did you go to your bedroom?
Yeah.
And were you able to get into your bedroom right away?
No, the door was locked, and that's when I knew something was wrong.
Oh my gosh.
Unlocking the knob. I just saw blood everywhere, and the window is open.
Oh
I
my
ran
god.
downstairs and went outside. I just looked around in the backyard below that window, and I saw Lindsay.
Where was she in relation to that window?
Directly below it.
Down here by the window well?
Oh my goodness. A 2-story fall? That's gotta have hurt.
Yeah. She had deep cuts on her wrists, and she had a red line across her neck. I wasn't sure what it was at first.
My goodness.
But she cut her neck.
Yeah,
I said, what happened?
Dang.
And what was her response?
She said, I tried to kill myself.
Of course.
Kids. She said they're in the basement.
And when you went left, what did you see?
Oh no.
I saw Cora. She had a band around her neck. I saw Callan. He was next to her. He had a band around his neck. I tried to find Dawson. I looked in the bathroom and on the other side of the couch, and then I went to the other side of the basement, and he was in the office. I knew he was gone.
And did he also have a band around his neck?
Yeah.
5-year-old Cora, 3-year-old Dawson, and 8-month-old Callan had all been killed at the hands of their mother.
Oh my god.
Yellow exercise
what?
band found with Dawson.
Exercise? Oh my gosh. Oh my. this shows a level of like madness and determination to do this that I have never seen. They're going to try and go for they're going to try and say something, aren't they? Let's continue.
Black exercise bands found with Cora,
Oh my gosh.
and then the blue exercise band found with Callan.
Of course.
And after taking their lives, Lindsay attempted to take her own life by cutting her wrists, cutting her neck, and then ultimately by jumping out of the window of her second-story bedroom. Lindsay survived, but the fall left her paralyzed from her chest down.
Dang, her chest down. That's got to be what the you know what? I don't care. She's a murderer.
And it also left her charged with 3 counts of murder for the death of her 3 children. And that's because, according to prosecutors, Lindsay's actions that day were calculated. Their theory as to why Lindsay killed her kids is that she was a mother who liked to be in control. She was particular about what they ate, what they did, who cared for them, and more. And as an example of this control they say she liked to have, they pointed to some notes she would leave her nanny when the nanny was caring for the kids.
And so, for example, on Tuesday, September 4th, she wrote, last fed at 6 a.m., give him a bottle whenever he wakes up. He likes it very warm. He's been resisting the bottle. If he won't drink it, after 45 minutes of trying, please text me to let me know. Put down for next nap 1 hour after he wakes. Try to put down drowsy but awake. But if he cries, pick him up and rock, bounce, or hold him until sleep, then put down. He usually sleeps 45 minutes, but let him sleep as long as he wants. These are very detailed notes that Lindsay is sending to the nanny, correct?
Yeah.
And then she also wrote, if you have time, wash and cut up veggies, sweet potatoes, 1-inch cubes peeled, broccoli, small pieces, peppers, 1-inch pieces, plastic Ziploc bags to put them in. Next bottle, 2.5 hours after the first bottle, correct?
What in the world? What are these instructions for a nanny? Good Lord. Is she OCD? Or is she just a type A personality that wants everything the way she wants it and doesn't care how inconvenient or tedious it is for somebody else to do it? Good Lord. How much you want to bet she killed the kids because she didn't want the dad to have them? Because, oh gosh. I'm getting ahead of myself. I'm sure I'll find out.
I believe what you're reading, yeah.
So very particular about what she wanted the nanny to do, how she wanted her to do it, and when to feed Callan, when to put him down for a nap, all of those things. Very particular, correct?
Sounds like it, yeah.
But prosecutors say with the birth of her 3rd child and the anxiety of having to go back to work, Lindsay started losing that sense of control she had always had.
Oh my gosh.
She began experiencing intense anxiety that spiraled into depression. Now, she did try to seek help, but according to prosecutors, when the treatments and the medications weren't working and the control she once had wasn't returning, the life Lindsay had was no longer the life she wanted. And so, according to the prosecutors, Lindsay decided that the best option was to end her life. But because of that need for control, she believed that no one would be able to take care of her kids like she could. And so her solution was to take them with her.
This was a woman who acted intentionally.
Wait, what? Go back.
According to the prosecutors, Lindsay decided that...
Go ahead. Back up it.
But according to prosecutors, when the treatments and the medications weren't working and the control she once had wasn't returning, the life Lindsay had was no longer the life she wanted.
Oh, boo-hoo, I don't have the life I wanted.
And so, according to the prosecutors, Lindsay decided that the best option was to end her life. But because of that need for control, she believed that no one would be able to take care of her kids like she could. And so her solution was to take them with her.
What? I'm sorry, what? You said what? Oh, I don't want to live anymore. I don't want to do this anymore. I hate my life. Oh, but he can't have the kids. I'll take him with me. Oh my God. Oh my God. This is going to be... How far am I into this? I'm only 5 minutes into a 36-minute video. I'm not going to get through this.
This was a woman who acted intentionally, rationally,
Yeah.
and swiftly to accomplish a very specific goal: to kill. She was someone
Exactly.
who liked to control every little detail.
Exactly. She wanted to control. She wanted to deprive him of any contact with the children if she couldn't control it. Because Lord, oh my
Her
gosh.
life, of her family's life. It was hard for her to maintain that control. It was hard for her to bond with her kids. She made a choice, a deliberate and intentional decision.
It was hard for her to bond with her kids. What? I'm sure we'll find out more, but what?
That she did not want to try anymore. And because no one could take care of her kids the way she wanted them to, she had to take them with her.
Oh my gosh.
The evidence will show you she was not psychotic that day.
Of
So
course
that's
she
the
wasn't.
prosecution side. And Lindsay doesn't disagree with some of that. She doesn't dispute that she was mentally unwell. She doesn't dispute that she was trying to seek help and that she is the one who ultimately killed her children.
She's living her own hell. She knows what happened with those kids.
But what she does dispute is whether she is criminally responsible for doing it.
Kind words, Sam. Kind words. Screw you, you stupid witch.
But I suggest to you that the issue for consideration is what was going on in that woman's mind.
In other words, Lindsay's
What was going on? Only she and God truly know. And I bet God is not pleased with what she has done to the least of these.
defense is that she cannot and should not be held criminally responsible for killing her kids because when she did it, she was suffering from a mental disease or defect that prevented her from appreciating or fully grasping the wrongfulness of what she was doing.
Ignorance is no excuse. Ignorance of the law is not an excuse against the law. I've been told this and told this and told this through countless movies, countless TV shows, and even personal experience in a couple of cases. And in all of those cases, not being able to tell the difference between right and wrong does not absolve you of the consequences of your actions. Screw that.
Her version of events is that a voice told her to kill her kids and then kill herself, and that she had to do it right in that moment while her husband was away, or else she would never have another opportunity to do it. And
She's... Oh, sure. Show a picture of her with her kids. Oh, look at that happy family. And yet, a couple of years later, they're gone. She's paralyzed because she decided she didn't want to live the life anymore. Oh my gosh.
so that is the crux of this trial. Did Lindsay Clancy fully understand what she was doing when she killed her kids?
Yes.
And of course, because no one was inside of Lindsay's mind that day, the defense and the prosecutor are using what led up to that day as evidence as to what was going on in her mind. Both sides are pointing to things she said or didn't say, the things she wrote down, the things people saw of her, the appointments she had, the interactions she had, the medication she was taking or not taking. All of that they are pointing to as evidence as to what was going on in Lindsay's mind. And just so
You don't have to look at all the information. You don't have to look at all the evidence to know what's in that monster's mind. All you got to do is realize 3 innocent children are gone, and she was the sole culprit.
you are tracking, the timeline in which all of this happened is a period of 4 months. It's from September 15th to
Oh my God. 4 months. It only took 4 months to go from I'm depressed to I'm going to kill my kids. How damn stupid do you have to be?
2022, when she had her very first appointment with a psychiatrist, until January 24th, 2023, the day she killed her kids. So that's the background and the setup. So now let's talk about what led up to that day. And actually, before we get into it, it's worth noting that the prosecutor in this case is a woman named Jennifer Sprague. So anytime I play a clip of a woman asking questions, you can assume that's the prosecutor. And then Lindsay's defense attorney is a man named Kevin Reddington. So anytime I play a clip and a man is asking the questions, it's safe to assume that's Lindsay's defense attorney.
Okay.
Okay. So Callan Clancy, the baby of the family, was born in May of 2022.
Okay.
And June, July, and August were all fine for Lindsay, but by the fall, there was a change.
What happened in September, October of 2022?
Lindsay's mental health started to deteriorate, just increased stress and anxiety.
Did she, as a result of that, go to see or reach out for help to see someone?
I believe it was Jennifer Tufts.
The first doctor Lindsay sees is a psychiatrist by the name of Jennifer Tuft. And Jennifer is key to this entire story.
What is wrong with her skin tone? It's like she's yellowed out. I don't know if it's the editing of the video, the lighting of the room, or just her pasty-faced complexion, but something looks wrong on this lady.
Because she is the doctor Lindsay saw throughout the entirety of the 4 months. Lindsay saw Dr. Tuff 14 times, beginning with her first appointment on September 15th, 2022, which was done virtually.
I believe her biggest concern was about anxiety.
This first meeting with Lindsay, what was her mood?
It was okay.
And what was her affect?
Anxious.
So she was reporting to you, she felt okay. You were seeing she looked a little anxious.
Yes.
I mean, I see my therapist telehealth because he works in an office a couple of cities away, and it's kind of difficult for me to make the trip. But telehealth for an initial appointment is not optimal for proper care. There are things that you cannot tell from a video call because there are going to be tells with every condition as far as whether or not the patient is lying to you or being genuine with you, because you will either have olfactory or auditory or verbal or other tells that give you a closer and clearer picture of the person's state. You don't get that with a face in a video frame on a conference call. You just don't. And so their first problem was having the initial appointment by remote.
And based on your evaluation of Lindsay Clancy that first day, September 15, 2022, did she appear to have any issues with judgment, insight, or orientation?
No.
And did you note any signs or symptoms of psychosis with Ms. Clancy that day?
No.
And based on your evaluation with Ms. Clancy, everything you learned about her history and how she presented that day, did you have an initial diagnosis?
Yes.
And what was that?
It was a generalized anxiety disorder where an individual may have a lot of different worries. They may also have physical feelings of anxiety, but they're worried about a lot of things, not really just one thing specifically. And it was an adjustment disorder with depressed mood. So they don't meet the full criteria, say, of a major depressive disorder, but there were some symptoms of depression.
Generalized anxiety, some symptoms of depression, some expressions of depression, but no clinical depression. I mean, this is really early in the video. This is like only 10 minutes in. How much you want to bet she's not actually psychotic, but she's establishing a timeline? I don't know. I question. I wonder.
So I recommended a medication sertraline as well as individual therapy.
Right off the bat? Medication right off the bat? Without doing a proper blood panel to see what does and does not work with her body's chemistry without doing a proper face-to-face interview where you assess and identify the issues that the patient has but is not necessarily verbalizing, so that you can come back and properly address them over time, and without having actual opportunity to get to know them outside of their safe space. Because I don't know about you, but meeting a therapist in their office versus meeting them through telehealth at home, I act different. She would have acted different too. You would have seen more of the presentations in office. I digress.
And the medication sertraline, is that Zoloft?
Yes.
Lindsay's next.
Oh, good gosh. Starting her off on Zoloft too. That's a wonderful first step. Next
appointment is 15 days later on September 28th. And by this appointment, Lindsay hadn't started taking the Zoloft and hadn't seen the therapist that Dr. Tuff recommended.
Okay. 13 days later, had not started seeing the therapist, still only seeing the psychiatrist, which is another problem. Psychiatry is the practice of assessing a patient and determining medication. Psychotherapy or psychology is the practice of helping the patient cognitively and internally process and manage emotional and psychological states. So she not only hasn't gone to see a therapist to work through her problems with them, but she's also not been taking the medication that they explicitly prescribed for the issue. I don't know about you, but if I'm suffering from depression or anxiety or any of this crap, and someone gives me something that's supposed to help tide me over until I can see someone, not only am I making that appointment to see that other person, I'm taking the damn medication the first day I can. Just saying.
But according to her, she was feeling better.
So at this point,
She wasn't feeling better, because I don't think she was feeling bad at all to begin with. That's just my estimation.
she was improving, and we decided to pause on the medication question and have her meet with one of our therapists.
Okay.
So that
Did
first
she?
appointment was on September 15th. You recommended therapy. The next appointment was September 28th. So had Lindsay not scheduled a therapy appointment yet with Jennifer McAllister at that point?
I'm not sure when she called to schedule that.
Lindsay's third appointment was on October 3rd, 2022, and it was again a virtual appointment, and it was for two reasons. Number one, Lindsay wanted Dr. Tuff to fill out a form allowing her maternity leave to be extended.
Thanks again for all your help at our last two appointments. While I'm feeling just better enough to function without medication, I did reach out to my employer about extending my leave for reasons of postpartum anxiety/depression. I don't feel mentally well enough to return to taking care of patients with a baby at home that still won't take the bottle. I know this will trigger my anxiety too much, and also having to stay up all night as a nurse, I don't feel it's possible right now.
Oh. So the picture becomes even clearer. She's a nurse. She knows something about these things. She knows something about, maybe not completely, maybe it's just kind of tertiary knowledge from her studies in college or whatever, but she knows a little bit about psychological, psychotherapy, psychiatry, other things, because you do pick up things while you're going through nursing school, because you've got to at least know some of the presentations, some of the symptoms, so that when you're doing triage work or whatever, you can actually do your work. Oh, great. So she kind of knows her way around medical and psychological stuff. Sounds to me like she wanted she had a pretty good idea of how to work the system for what she wanted.
They asked that my provider could fill out a form so they could process this request. Can I please send you the form to fill out? And you responded on September 30th, 2022 at 2:41 p.m. This type of paperwork often requires a lot of information, so it's best if we go through it together in an appointment. Do you recall that?
Yes.
And secondly, that period of Lindsay feeling better was over. According to her, she was back to feeling anxious.
Well, she was
Oh, how convenient. She was better, now she's worse.
having more anxiety again. It seemed like maybe it had started getting better, and then it was kind of where it had been when she initially reached out. And so she was feeling like a medication might be helpful.
Lindsay's
great.
fourth appointment is on October 20th, 2022, and at this point, Lindsay had started taking that Zoloft. But after taking it for a week, she increased the dosage because that's what Dr. Tuft had originally instructed her to do. And according to Lindsay, it made her feel terrible.
Okay. As a person who has been through the gauntlet when it comes to finding medications that work and also figuring out how to manage medications that may initially have issues, you need to let it build up in your body over time in order to have your body adjust and adapt to the medication. So yes, you will feel bad for a bit, but you're not going to feel bad forever. Keep taking the meds.
She was having increased difficulty sleeping. She had loss of appetite, diarrhea. She was feeling her mood was down. She was tearful and feeling very foggy. And
Okay, let me do something in a second. Zoloft side effects. Let's see. Common early side effects as listed by Google: nausea and upset stomach, diarrhea, trouble sleeping, insomnia, drowsiness or daytime fatigue, increased sweating, tremors or mild shaking, jitteriness, or increased anxiety. Yeah, so basically, she's like, oh, I can just Google what the side effects of this medication are, and I can say, oh, well, it's not helping me.
feeling very anxious.
At this meeting with her, did you ask her if she had any suicidal thoughts?
Yes.
What was her response?
No.
Did you ask her if she had any homicidal ideation or thoughts?
Yes.
What was her response?
No.
Did you ask her if she was hearing any voices or seeing any visual hallucinations?
I'm not sure if I asked that in that appointment, but she was very clearly not psychotic.
Did she also tell you that she was worried about getting suicidal thoughts?
Yes. It was one of the things that she was anxious about. It was
So even as early as the fourth appointment with this doctor, she's saying she is worried about having these thoughts. I wonder if this will come up later.
a fear of one day having suicidal thoughts if she were to continue to feel poorly.
All right, so then there was an appointment the following day on October 21st?
Yes.
Wait, what?
Was one of the things that she was anxious about. It was a fear of one day having suicidal thoughts if she were to continue to feel poorly.
Okay. If I continue to feel poorly, one day I'm going to try and off myself. I fear that. I do. I fear that. I wonder.
All right, so then there was an appointment the following day on October 21st?
Yes.
So why did she have an appointment that following day?
Because she was feeling pretty poorly after starting the Zoloft, so we were following her closely.
What was the plan that
Wonder how long they were following her closely.
was formulated on October 21st?
So the plan was that she start a medication called Ativan to be taken as needed, which means not necessarily every day, but in the instance of severe anxiety.
And was there also, again, a recommendation to go to Ms. McAllister for therapy?
Yes.
So that's 5
Okay, I'm sorry. You're looking at over a month of appointments already between when she started seeing the psychiatrist and when she got her second medication, and still has not scheduled a therapy appointment with this Miss McAllister. Why? Why? Because honestly, I think she was aware that if she went to the therapist and they worked through the things together, as she was saying, if she was dealing with, she would not be believed, but she would be found out. She knew that if she created that paper trail, she would be found guilty rather than innocent. That is, this is all conspiracy so far. We don't know if she planned this as far back as 4 months ago, but I have a hard time believing that if she actually is suffering this much, that she would not go and get the proper help through the proper channels.
Appointments over the span of 1 month, and Lindsay really hadn't started to see much progress. She wasn't reporting that she was feeling suicidal or homicidal, but she did express fears of becoming suicidal.
Oh, great.
Dr. Tuff.
My thoughts exactly. My reaction exactly. Like, oh, I'm afraid I will be. Establishing a timeline.
Told her to try out the newest prescription and come back in a week to update her on how she was doing. And when Lindsay came back, there still wasn't much improvement.
What was her mood according to her?
It was anxious and depressed.
Anxious and
did
depressed.
You discuss with her whether she was taking the Ativan and whether it was working?
She said that it was not helpful for her sleep, but it made her feel less anxious.
Did you ask her that day if she had any suicidal or homicidal ideation?
Yes.
And what was the response?
No.
Did you see any signs of psychosis that day?
No.
And what was the plan?
Did you see any signs of psychosis that day? No. This will probably become a consistent and relevant thing in the entire case. Is was she psychotic? No. Was she psychotic? No. Was she psychotic? No. And so her claim that she was psychotic, her claim that she was insane, is an absolute fabrication meant as a smokescreen, not as truth.
After meeting with Ms. Clancy on the 26th.
So we discussed starting the medication Buspar at 5 milligrams.
Oh, I take that one. It's supposed to be a helper medication for antidepressants and anxiety medicines that you take. So, yay.
Twice a day. It lowers anxiety.
Now, throughout this process, Lindsay
Oh, no, never mind. I'm thinking of, oh gosh, Abilify. That's the one. Never mind. Wrong one. Anyway, let me back up a little.
26th.
So we discussed starting the medication Buspar at 5 milligrams twice a day. It lowers anxiety.
Now, throughout this process, Lindsay continuously expresses that she is hesitant about starting new medications because of the risk of becoming addicted to them.
Oh, how convenient. Oh, I'm afraid of starting medication because I'm afraid I'm going to end up becoming addicted to them.
So even though Dr. Tuff prescribed this Buspar at Lindsay's next appointment, she tells Dr. Tuff that she never started it.
So she did not start it.
She didn't start the new medication after asking for a new medication. Woman, I'm going to lose my patience with you because honestly, every time you give her a new medication, you're not helping the problem. You should tell her in no uncertain terms, if you're not going to take this medication, I'm not going to prescribe you another one. I'm not going to prescribe you medication after medication after medication if you're not going to take this. Because honestly, sorry for my language, but if you're not going to take the medication, where is it going? Huh? Where is it going? This kind of crap goes for a good penny over on the black market. We don't want you to be feeding the pill pushers and the pill poppers with your supply that you're getting supposedly to treat you.
She was too afraid to start a new medication.
And did you ask her if she had any suicidal or homicidal ideation?
Yes.
What was her response?
No.
Did you see any signs of psychosis present in her that day?
No.
See, again, no psychosis.
So the plan at that point was just to taper off the Ativan, but nothing was added at that point?
Yes.
So at this point, it's been a little over 2 months of seeing Dr. Tuff, and Lindsay and her husband really don't feel like she's
October, November 15th. Yep. 2 months.
getting any better. So Patrick's mom suggests that Lindsay see a woman by the name of Julie Paul. Julie was a nurse practitioner at South Shore Health Facility, and she was leading a postpartum psychiatric program. So
postpartum psychiatric program.
Lindsay goes to see Julie Paul on November 21st. She again gets questioned on thoughts about self-harm and other harm, and she also ends up getting a new prescription.
Yes, I asked her specifically if she felt like she wanted to harm herself or her children, and she said no.
And how about asking her about homicidal ideations?
Yes.
And did she indicate whether she had any?
She did not.
Did you also ask her whether she had experienced any auditory hallucinations?
I did.
And did she experience any?
Not at the time, no.
And did she indicate to you whether she'd ever experienced any?
No.
So for this patient, for Lindsay Clancy, what did she identify as the reason for the visit?
So she said pretty much I cannot sleep was her major concern.
Now, once you were able to kind of gather all this information from her and do these screenings, were you able to come up with an assessment and a plan?
So we had discussed starting Prozac. So I gave her 10
It keeps getting worse. Now she's got 2 doctors giving her medications that she's not going to be taking.
milligrams for the first 4 days to make sure there were no adverse reactions. And then I was going to increase her to 20 milligrams if she tolerated that well.
Okay. And what about some of the medications that she had already, that she was already on, the Ativan and Benadryl and the Trazodone? Did you have a plan for those?
Benadryl? Oh, heck.
I did. So I encouraged her to take the Ativan just in the beginning, just to help her be more comfortable with the anxiety and to make sure that it didn't interfere with her sleep.
And as far as follow-up with you as the clinician and prescriber, was there a plan set for when she was going to return?
Yes, we had established a return in 2 weeks.
Lindsay was scheduled to return to the South Shore facility for her follow-up in 2 weeks, but with the understanding that Julie Paul was no longer going to be her provider. It turns out Julie Paul was moving, and so Lindsay was reassigned to a woman named Dr. Rebecca Gelada.
Good Lord. So not only is she finding another doctor to treat her, but then she's being shuffled around to a new provider because the provider she just started seeing is now moving. You see, this is why I think there should be a month-long hold before a practitioner is leaving a practice. That they are not allowed to take on new patients because you upend their schedule and their established providers too often. And with these psychiatric patients, that can cause more problems, more stress, and more friction than it needs to be.
Did Dr. Gelada, to your knowledge, put her on medication?
Yeah.
And what was the medication, if you know?
Mainly Seroquel and benzodiazepines. Ativan.
Great. Oh, I forgot that Ativan is benzo. Lovely. Oh, and Seroquel. Okay, lovely. More medications, more chemicals in the body, more chemicals in the brain. If she were to take them, if she were taking them. I don't think she took any of them. I think even the ones that she said she was taking, she wasn't. I mean, I could be wrong. Let's see. Seroquel. Antipsychotic medication prescribed to treat schizophrenia, bipolar, and major depressive disorder, which nowhere in her records at this point does she have a note of having.
And to your observation, again, you're not a doctor, what you saw of your wife, was she affected positively or negatively by the Seroquel that she was on?
It appeared that she was affected very negatively, and she was reporting that that she was getting worse on the Seroquel.
Shocker. It's an atypical antipsychotic medication for 3 very specific disorders: schizophrenia disorder, bipolar disorder, and major depression. All 3 of which she has not been described as having.
And do you know, did she report that to Dr. Gelada?
Yeah.
Are you following that? So by
Okay, all right. So let's see. Zoloft prescribed. Started Zoloft in mid-October after having it prescribed in September. October, Medication changed to Ativan and Benadryl. Zoloft discontinued after adverse reaction. Insomnia persisted. On November 16th, trazodone. Oh, I used to take that. That was actually what I tried to, never mind. Presented with insomnia, anxiety, palpitations. Allegedly ineffective. November, Prozac. Very frustrated and scared, sleeping 3 hours a night. Ambien, Remeron, Klonopin, then Seroquel. Oh, good Lord. Oh my gosh. Late November, December, Seroquel. Complete alleges suicidal ideation, auditory hallucinations, emotional blunting, like a zombie. Seroquel called hotline and crisis service. Patrick reported medications made her 10,000 times worse. Seroquel taper advised, reported numbness, inability to feel love, severe depression, EPDS 23 and GAD 720. What the heck are those? EPDS 23. A high score on the 10-item Edinburgh postnatal depression scale. Okay, GAD 721. Oh, okay, so postpartum depression and general anxiety disorder, and both are high scores. Stops Seroquel, benzos, trazodone, admitted with ideation, anxiety, racing thoughts, insomnia, memory issues, discharged after 5 days. Valium and then amitriptyline. Oh, Lord. Great. So she's practically a walking, talking, a pharmaceutical nightmare.
At this point, and I don't think I included all the clips of all the medications, she's been prescribed Zoloft, Ativan, Benadryl that she got herself, trazodone, Prozac, Ambien, Remeron, Klonopin, and Seroquel. Now, Lindsay wasn't taking them all at one time, and in fact, she scheduled an appointment with Dr. Tuff to tell her that she was transferring her care over to them and would be going by the prescription recommendations that they gave. But that was only short-lived, because by December 1st, Lindsay was back to seeing Dr. Tuft in her virtual appointments.
And what was discussed at that appointment?
That she wasn't getting better. She had tried the Ativan taper, but without the Ativan, she was having a lot of difficulty sleeping. So she tried a few different medications, a few different medication combinations, but she was having trouble with them.
And these medications that she was talking to you about, those weren't prescribed by you, correct?
Correct.
Did she tell you that those had been prescribed by her provider at South Shore Perinatal Clinic?
Yes.
Did she also tell you that she was having some intrusive thoughts?
Yes.
Did she tell you what those intrusive thoughts were?
She said it was a feeling like I'm going to die.
Not a feeling that she wanted to kill herself, but a feeling like she was going to die.
Yes.
Oh, okay. The plot thickens a bit. Now she has impending doom thoughts. Great.
Did you ask her if she had suicidal ideation?
Yes.
What was her response?
So she denied having suicidal ideation, but she was feeling pretty badly. She said she was close to it, meaning close to having some suicidal thoughts, and that.
I know, girl. I know. I'm just as confused as you are, because how are you close to suicidal ideation but not there? Huh? What? Huh?
She was feeling very hopeless, but she didn't have any active thoughts of hurting herself, didn't have any intention of doing anything, didn't have any plans.
Hopeless, depressed, possibly on the edge of suicidality. No plan, though. Oh, that's lovely. That's a great combination for a spur-of-the-moment drive off a cliff or something like that. I'm sure there's going to be mention of that, too.
Did she also tell you, and this is a quote in the records on page 144, I think it's my problem. I keep reaching out to different people and not sticking with the plan.
That's what I documented.
Honestly, she's probably right. If she'd have stuck with one provider, they might have been able to catch her before she did this horrible, horrible thing.
And did you discuss that with her, that concern that she kept reaching out to different people and wouldn't stick with the plan?
Yes, I advised that she have one person who is managing the medications so that it's very clear what's happening.
Around the same time Lindsay tells Dr. Tuff that she's having intrusive thoughts, she also tells her husband Patrick that she's having these thoughts.
She described thoughts of hurting the kids or them having some sort of ailment.
And did she tell you whether or not she had specific thoughts of how she would harm the kids?
No.
And she didn't describe that as hearing this external voice telling her to harm the kids, correct?
Correct.
She told you she was having intrusive thoughts herself of harming the children, correct?
Correct.
So, see, okay, if I can be very direct and very just clear about this, she tells her husband, I'm having thoughts about hurting the kids, not I'm having a voice tell me. And then later changes her story to, oh, well, the voices told me to do it. Right. And I'm the King of England. Sure.
How many times did she tell you this, that she had thoughts of harming the kids?
A couple times. I think I asked her at some point, do you feel like you need to be kept away from them? And she said no. And then, it was very confusing because a minute later she was making them lunch or playing with them or, getting them ready for bed or whatever it was. So.
Let me get this straight. You hear this not once, but twice. A couple of times, he's saying. And your first thought isn't, I need to get my wife help because I don't want to lose my kids. I don't want my kids to get hurt. I'm not saying it's his fault. I'm not. Don't even get that twisted. I'm not saying it's his fault. I'm just saying that if I'd have been the kid's dad, I would have been like, okay, honey, I love you. And because I love you and because I love our kids, we're going to see someone who's going to get you help. We're going to go see someone and you're going to get better. Before you can see the kids again, we need to at least get you checked out because I don't want you to do anything that's going to make both of our lives a mess, because that's exactly what happened. And I mean, there's so many points of failure in this entire story, and I'm sure we haven't heard them all yet. It's a catastrophic sequence of events that has failed and failed and failed time and time again, of not only treating her if she truly does have these issues, but also protecting the kids and protecting their father from the repercussions of her actions. And it's just plain ridiculous.
Were you concerned for the kids' safety at that time?
No, I wasn't, because she wasn't showing any intention of harming the kids.
She told you she didn't have a plan, is that correct?
Correct.
Somebody educate me. If people are having certain thoughts, but they say they don't have a plan, does that invalidate the thoughts? Does that mean you should not take those thoughts seriously?
Exactly. I don't know about you, lady, but I hear someone say, oh, I'm having thoughts of hurting or doing blah. Oh, but I don't have a plan. That just means you're more dangerous, because your desires, your urges, your intrusive thoughts will end up becoming an impulsive decision, an impulse that leads to a tragedy. It makes no freaking sense. Why?
Weeks after Lindsay admits to having these intrusive thoughts, the thoughts get worse, and Patrick insists that she go to the ER. And that ER visit resulted in her being admitted to a program for postpartum women, but she didn't stay long.
It wasn't involuntary? It wasn't involuntary? It should have been involuntary. I'm sorry. I'm sorry. It should have been involuntary.
Being at Mass General on December 15th, did she go to Women and Infants Hospital in Rhode Island to attempt to get into their... being at Mass General on December 15th, Did she go to Women and Infants Hospital in Rhode Island?
Women and Infants Hospital. Okay, so okay, never mind. I'll leave that for now.
To attempt to get into their postpartum program.
She went in as scheduled.
And at some point in time, did Lindsay reach out to you to say she wasn't staying at the program and to come pick her up?
She actually said that the providers at that program suggested to her that she call me and have her come get picked up, and then that I should go in and meet with the providers.
Okay.
Their recommendation was that the program wasn't right for her.
Right. And so.
Okay. All right. I did some Googling. I did some research. Women and Infants Hospital of Rhode Island is the top tier hospital and national leader in women's health, maternity, and specialized neonatal care. It also provides postpartum, any postpartum depression, it also provides a comprehensive, highly specialized continuum of care for perinatal and postpartum mood disorders, and is considered one of the best, if not the best, program in the country. So if a program that is described as top tier for this kind of disorder is saying she doesn't fit in here, then the narrative of postpartum depression or postpartum psychosis falls on its face. It falls on its face, and it has no standing in any degree.
You guys returned home, is that correct?
Yes.
After that stay, Lindsay schedules an appointment with Dr. Tuff to give her an update. She fills her in on the ER visit, on the half-day program stay, and the overall takeaway that she still hasn't gotten any better. But the prosecution highlights that while all of this is going on, these intrusive thoughts, this not sleeping, feeling anxious, depressed, and not ready to go to work, Lindsay was still going to the gym, still taking her kids to doctor's appointments, and still socializing with her friends.
Go for, let me just listen to that again, guys. Listen to that again.
With Dr. Tuff to give her an update. She fills her in on the ER visit, on the half-day program stay, and the overall takeaway that she still hasn't gotten any better.
She still hasn't gotten any better, in her own words, but
the prosecution highlights that while all of this is going on, these intrusive thoughts, this not sleeping, feeling anxious, depressed, and not ready to go to work.
Sounds like a pretty debilitating state of affairs, right? But
Lindsay was still going to the gym, still taking her kids to doctor's appointments, and still socializing with her friends. Still doing her normal routine, still taking her kids to appointments. Sounds like she's not
quite being truthful about how she's feeling.
She's still bringing the children to doctor's appointments during that time, right?
Yeah.
December 27th, and make an appointment for Callan and Cora when they weren't feeling well. Do you remember that?
Yeah.
And then on December 30th, she was able to take Callan to the doctor that day as well and interact with the staff. Is that correct?
Probably.
And during this conversation at dinner, did she ever mention that she had suicidal thoughts?
No.
Did she ever mention that she had homicidal thoughts? No.
Of course
Did
not.
she ever tell you that she was hearing voices? No. Did she ever tell you that she was having intrusive thoughts of her own? No. Other than having an issue with sleep, did she mention any other issues that she was having?
She mentioned feeling anxious.
Okay, so all of that was mid-December. Now fast forward
Okay.
to New Year's Eve of 2022.
New Year's
On this
Eve.
day,
Lovely.
Lindsay is feeling especially bad.
Okay.
So she goes back to the ER and eventually checks herself into a mental health facility called McLean, where she sees a number of doctors.
She was
McLean Hospital, huh? McLean Hospital. Oh. A world-renowned psychiatric facility located in Belmont, Massachusetts, consistently ranked as the #1 freestanding psychiatric hospital in the United States and #2 overall hospital for psychiatric care by U.S. News and World Report. Okay, let's see what happens there.
still talking about thoughts of suicide, and I was exhausted. I said, I think it's time to go to McLean. We didn't have a diagnosis, so we just didn't really know what was wrong.
Wait, what? 3 months in, 3 months in, you still have no diagnosis. Not at all. Not one. How could that be unless there is no diagnosis? There is no actual psychiatric problem. It's all a fabrication of a woman determined to end her children. If that's the case, I'm sorry, but I have no sympathy for anyone that helped to contribute to this successive series of catastrophic failures to protect those children. I am sorry. I have no sympathy for the mother who chose to fabricate a story to try and get out of being held accountable for her actions.
And I think for me, I was hoping that McLean could really evaluate her and try to figure out the best path forward.
Were you aware that night while at the hospital, Lindsay was taking selfies?
She was taking selfies?
No. Are you asking me?
Yes.
Yeah, I can see that.
And then the second page is just her legs in the doorway. Is that correct?
Yep.
Looky
As a
here.
result of going to Mass General and telling them about her suicidal thoughts, was she transferred to McLean Hospital?
Yeah.
Out of the few days that she was there, 5 days she was there, you visited 2 or 3 times. Is that correct?
Yeah.
I'm going to draw your attention to particular
A 5-day stay in a psychiatric hospital. 5 days. They found nothing. They determined nothing. They diagnosed nothing. 5 days.
patient by the name of Lindsay Clancy that arrived at McLean in the early morning hours of January 1st of 2023. Do you recall that patient?
Yes.
What was the chief complaint of the patient when she arrived at McLean?
Finding it hard to sleep if she didn't take medications. Ms. Clancy complained, there were several symptoms. One of the things that she did complain about was the numbness.
Did she report any delusions, hallucinations, or suicidal or homicidal ideation?
No.
Go figure. She's at the most premier psychiatric hospital in the United States and does not mention any of her psychiatric or psychological conditions that she says she has. My goodness.
Going to January 3rd, that was the first face-to-face contact you had with the patient, correct?
Yes.
And what were your observations of her mental status?
She was appropriately dressed. Her speech was of normal rate and volume. Behaviorally, she was polite and cooperative. Her mood, she appeared anxious.
She appeared anxious. Otherwise, she was composed. She was composed. She was dressed kind of nicely. She was not in any way visibly distressed or otherwise psychologically disturbed, is pretty much what she's saying.
Gave her a diagnosis of insomnia, with a mental health condition. She stated that she was anxious being in the hospital and that she wanted to be discharged so she could be home. With her family and her children.
And when she asked to leave earlier than Friday, what was your response to that?
I said she could leave provided she had psychiatric follow-up the next day. I wanted to ensure that if she wasn't able to sleep that night after discharge, that she could speak with somebody about it so that they could come up with a plan to ensure she could sleep and to monitor how she was doing off the medication.
Okay. So basically, she went in, told him, look, I'm having trouble sleeping. I'm also a bit anxious, but I'm anxious because I'm not home. I'm anxious because I'm not with my family. If you're actually, sorry, let me make this clear for those of you that are watching, that are listening to this BS. If you are actually suffering from these kind of conditions of suicidal ideation, homicidal ideation, depression, anxiety, all this other crap, you're going into a hospital that is known to be highly effective at dealing with these issues. If you're truly suffering from these conditions, you will ask for help. If you're already at that point, you're going to ask for help because there's nothing else that will fix it except for getting what you need. She isn't psychotic. She's evil. I'm sorry. I know. I don't normally draw black and white lines like this, but she's freaking evil. She is malicious. She's a murderer, and she used the system to provide her an alibi and a reason to not have been held accountable for her actions. That's all this is. It's documentation for her defense. And we're only at the 25-minute mark. We've got 11 minutes left. Let's finish this.
I did not have any concerns about her safety or a risk for anybody else.
Lindsay is discharged from...
You didn't have any concerns about anyone else? You didn't have any concern? Fair. She didn't tell you anything. She didn't tell you a damn thing that she was going through or that she's supposedly going through. So, of course, she wouldn't want, this lady wouldn't have diagnosed her or considered her a threat to anyone else or to herself. But damn if she's not going to make them regret that.
McLean on January 6th, and in the days following that discharge, she attended Cora's birthday. She mentioned to a few of her friends that she was having some internal struggles, and she had a few more appointments with Dr. Tuff.
So she was continuing to feel depressed. She was feeling numb. Well, she still appeared quite depressed.
And I believe in this note.
She had a few more appointments with Dr. Tuff.
So she was continuing to feel depressed.
Continuing to feel depressed.
She was feeling numb.
Feeling numb.
Well, she still appeared quite depressed.
And appeared quite depressed. Huh. Go figure. Sounds like you didn't get better. Sounds like you're just getting a witness.
And I believe in this note for under condition, you wrote deteriorating.
Yes.
And why is that?
So it sounds like a very strong word. I will give some context that it's not my choice of a word. I have three options.
It's not my choice of a word, but it's the closest thing to what was actually happening.
I'm filling that out. I can say a patient is improving, unchanged, or deteriorating. So,
Oh, that's why I love the very stringent and very rigid paperwork of a psychiatric facility, because it's just so it is so one-sided. It's either, oh, the patient's getting better, oh, the patient's getting worse, oh, the patient hasn't changed. It's never, okay, let's describe the severity of this shift from either previous to up or previous to down, because deteriorating sounds catastrophic. Improving sounds wonderful. And it may not be that black and white.
she wasn't improving and she wasn't really unchanged. She appeared a little bit worse than the last time I had seen her. So the best word is to say deteriorating.
Did she send you
Oh, only a little bit worse, huh? She had you fooled.
emails on January 11th, 2023, asking you about your knowledge and thoughts on ketamine therapy and whether that would be a good option for her?
Ketamine therapy? Ketamine therapy? Okay, what does ketamine therapy do? Rapidly rewires and builds new connections in the brain to provide swift relief from severe mental health conditions and chronic pain. So basically, it's a quick fix type deal for psychotic and psychiatric issues. So, wonderful.
Yes, she did. But I didn't think we were at that point yet.
Did she say I'm
You were at that point and further.
still feeling a very low mood, no motivation, just very depressed? This has been going on for months now, and I'm getting desperate for something that would work quickly to get me out of this depressed state. Do you remember that being part of the email?
Yes.
Going on. Did she say, I'm still feeling a very low mood, no motivation, just very depressed? This has been going on for months now, and I'm getting desperate for something that would work quickly to get me out of this depressed state. Do you remember that being part of the email?
Yes.
I'm looking for something to work quickly to get me out of this depressed state. In other words, I'm hoping something will snap me out of this before I kill my kids. Because I've been planning it for months.
And what was your interaction with Ms. Clancy on January 16th?
Her mood was still very low. She was still depressed. She was able to get out of bed and take care of her basics like hygiene and eating. Her concentration was fine, and she was doing what she needed to do to take care of her baby, though she subjectively felt like the bonding was forced with the baby.
There we go. There's the thing. There's the reason. The bonding was forced with the baby. The bonding might have been forced with the other two. Oops. What did I break? I don't know. Anyway, the bonding was forced with my kids. I couldn't feel love or joy or care for my kids. So I decided I'm going to take them out. I don't want to deal with them anymore, but I also don't want him to have them. So I'm just going to, this lady's pissing me off. How many minutes we got? 27 minutes. Oh God, we got 9 minutes left. We got 9 minutes of this left. Great. Okay, well, let's try and get through this.
Okay, so that gets us to the 2 days before the day of the incident.
Great.
And these lead-up days are critical because, according to the prosecutor, everything about Lindsay's actions during those 2 days shows that she was fully aware of what was going on. She was not experiencing any symptoms of psychosis. She was not hearing voices or anything that would indicate that she could not fully grasp the consequences of her actions.
Right.
So starting with January 22nd, 2023, the prosecutors put up witnesses to attest to how Lindsay was behaving, including some friends she saw at a bonfire, a friend she texts with about hoping to feel better soon, and they're able to question Dr. Tuft about these 2 days.
Lovely.
Because Lindsay's last appointment with Dr. Tuft was the day before the incident.
Great.
And directing your attention to Sunday, January 22nd, 2023, did you have a small gathering at your home?
Yes, their family came over to my house.
Great.
Do you recall describing the day previously as a perfectly normal afternoon, really nice?
It was a nice day. Yeah.
Okay.
And throughout the course of that day or that afternoon that you were with her, did you notice anything change about how she was communicating with you? Like, did she start to talk faster or seem confused in any way?
No.
No.
Was there anything that happened at that interaction that made them abruptly leave?
No, I think it was like nap time for the kids.
Okay. So in terms of January 24th, 2023, when the children were killed, how close in time were your text messages to that incident?
Only a few days.
Okay. And what was that text conversation?
She had shared that she had been taking a medication that caused her to have some dark thoughts, but that she was going to, or had been tapering off that medication and was trialing new ones that would remove those side effects. And
She was taking a medication that was making her have dark thoughts. Huh, how convenient.
be more helpful and therapeutic to what she needed.
Did she ever express at any point that she wanted to harm herself?
No.
Did she ever express that she wanted to harm the children?
No.
Did she ever tell you that she was hearing voices?
No. I did not speak to Lindsay. I sent her a text message on January 23rd.
And what did you say in your text message?
I'm paraphrasing, but I believe I said, "Hi, I've been thinking of you, wondering if you're still in the daily program," I believe I said, so maybe I didn't realize it was inpatient. And she responded.
And what was her response?
Again, I'm paraphrasing, but she said something like, "I'm no longer in the program. I'm continuing to work with my psychiatrists to find the right medication that will allow me to sleep at night but still function during the day. I've had a lot of bad or negative side effects from the medication, so I've had to come off of them and go on new ones, and it's been very difficult."
Dang. Imagine being her friends.
Your next appointment with her was January 23rd, 2023. Is that correct?
Yep.
Yes. She has to force herself to get out of bed and out of the house, but is able to do that. And she is sleeping okay.
Has to force herself out of bed, but she's sleeping. I wonder.
And did you ask her if she had suicidal ideation or homicidal ideation on the 23rd?
Yes, I did.
What was her response?
No.
Lies.
At any point in time, did she tell you she was planning to kill herself?
No.
At any point in time on the 23rd, did she say she was planning to kill her children?
No, absolutely not.
Yeah, because she'd be a mandatory reporter. She would have had to call the police and have them do a wellness check to make sure she was all right, to make sure the kids were safe, to make sure everything was good. That's the thing. Psychologists and psychotherapists and psychiatrists are all required by law, if there is a reasonable risk or reasonable belief of danger to the patient or to someone else, they're required to follow up with law enforcement and the proper authorities.
At any point in time during your interaction with her in that session, was there anything about her affect or demeanor, her behavior that indicated to you that she was a danger to herself or others?
No.
No, no, no. I'm sorry. I love how you're just one word answer, one word wonder as far as, oh, there's absolutely nothing that I could have done. There's nothing that I saw. There's nothing that I was able to detect that told me that this lady was an absolute nutcase, or that this lady was pure evil. That's the only two options we've got. Either she's insane or she's evil. And I'm leaning toward evil because she doesn't seem insane. She doesn't seem like she's deteriorating. She doesn't seem, because it's one thing to excuse my language, it's one thing to bullshit a psychologist. It's another thing to fool your friends. It's another thing to do that. Your friends know you. Your friends have been around you. Your friends can tell when you're off, at least good friends, your friends and your family. It's another thing to fool a psychologist that sees you for an hour once a week, maybe.
Is there any reason, based on your evaluation of her in that session, that would give you grounds to file a Section 12 on her that day?
No.
Of course not.
And then comes January 24th, the day of the incident. Lindsay had spent that morning at the doctor's office with Cora.
And speaking specifically to January 24th, 2023, that was Cora's 5-year physical, is that right?
Yes.
And sometimes in the record it's called a well visit?
Yes.
Did you notice anything out of the ordinary about Lindsay Clancy's demeanor or behavior or interaction with you?
No.
Was she able to answer your questions?
Yes.
Did you have any trouble understanding her at any point?
No.
Did she seem to have any trouble understanding you?
No.
Did you have a discussion with Lindsay Clancy about Cora having some stomach aches?
Yes. So we talked about the belly pain she was having. From what I could tell, I thought constipation might be possible because it's something we see a lot in kids. So I had suggested we try Miralax, which is a common stool softener we use, and wanted her to see me within 2 weeks if Cora wasn't feeling better.
She then
Great.
went home, played with the kids, and by evening, she asked Patrick to go to CVS to pick up that Miralax and then go to the restaurant to pick up the takeout.
She planned a diversion, so she had the window of time to commit the crime.
Even called the CVS and the restaurant before Patrick left and held perfectly normal conversations.
Perfectly normal conversations. Perfectly sane conversations. And yet she was hours or minutes away from killing her 3 children. That's not a psychotic break. That is a crime in progress.
And did you give her any specific brand names or anything like that?
I just said that we carried Pedialyx, and I was 13 and 20.
Her voice, did it seem slurred or impaired in any way?
Not at all. It's a very normal interaction.
And directing your attention to 5:10 p.m., did you receive a call for a takeout order?
Yes.
And was that a male or a female?
It was a female.
Did she appear to have any trouble understanding you or the questions you were asking her?
No.
Did her voice sound slurred or impaired in any way?
No.
So that's the prosecutor's argument as far as the lead up to the murder. But they don't stop there. Prosecutors say what happened after the incident also shows that Lindsay was of sound mind.
Yep. Exactly.
A few days after this happened, did you receive a phone call from the defendant while she was at Brigham and Women's Hospital?
She didn't talk about our kids. She talked about what she went through. She said she heard a man's voice telling her that if she didn't do it now, she would lose her chance or something like that.
Did she
Lose her chance for what?
mention the children at all during that call?
I don't think so.
This is the face of a broken man that's had to lose his children, had to basically see the true horror of the world. This is a man that has gone through hell and will never be the same. Damn.
Did she mention the children at all during that call?
I don't think so.
She never mentioned the children. She talked about what she went through. She was clearly the most self-centered and narcissistic kind of person that you could ever imagine. That's why she did this.
On this particular night, February 2nd, do you remember her making a particular request of you or ask you for something specific?
I think that was the night she wanted to reach out to her lawyer.
And did you note that in your nursing notes?
Yes.
I want to direct your attention to March of 2023. Did you visit Miss Clancy while she was at the Spalding Rehabilitation Facility?
Yes. I remember her asking about my daughter. I remember her asking about any updates to life events for our friends. We talked about some hobbies that she was doing while at Spalding and then played a game.
At any point in time, did she mention the death of her children?
No.
At any point in time, did she break down in tears and cry about her children?
No.
Okay.
Huh. Go figure. She did not have any emotional reaction to the death of her children. She did not have any care for her children at that time. The only thing she wanted to talk about was herself and what her friends were getting up to. Oh, how are you? How's your family? What have you been doing? What are you up to? Blah, 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 blah. But as far as, I'm so sorry for what I did. I can't believe that I did that. I can't believe that I lost control. None of that. None.
Did y'all make it to the end of this? What are your
Unfortunately, yes.
thoughts? Can a person be fine 1 minute and then go into a psychosis the next?
Absolutely freaking not. Absolutely not. There's no way. There's no freaking way that this was a psychotic break. This was a calculated, cold-hearted, evil person deciding that they were going to make a rabbit trail, make a breadcrumb trail of supposed evidence of their psychotic episodes and their psychotic break, so that when they decided to finally commit the murder, they'd have an alibi or they'd have an excuse to walk away scot-freaking-free. Don't let it happen. Don't let it happen. Or this is going to be the signal call and the sirens call for a lot of other women to decide they can do the same dang thing.
Do you believe the prosecutor's theory that Lindsay got sick of trying to get help and just gave up and decided to kill herself and her kids?
No, I don't believe she got sick of trying to get help, because I don't think she needed help in the beginning. I don't think she needed help at all. What I think is she wanted that trail. She wanted that record. She had thought about this for at least a couple of months before, and then finally found out how to start doing the legwork to hopefully get her jail out of free card. Get out of jail free.
Let me know what you're thinking. And if you really made it to the end of this video, let me know if you want me to make a part 2 that highlights some of the points the defense has been making on cross-examination, like this one.
So forget all about my sloppy writing. I'm looking here on October 21st of 22. Is that correct, right up there?
Yes.
Okay.
Yes.
And can you just read this paragraph here for us?
No sleep last night. Falls asleep after 40 minutes. Heart racing, severe anxiety. Worrying about kids, baby, sleep. Yawns but not drowsy. Not hyper, pressured speech.
What was that? Not hyper what?
Not hyper, not pressured speech is what I meant. I know it doesn't say not, but that is exactly what I meant.
When did you see this that you noticed that it did not?
I hate this guy already.
Not say not?
I don't care what it says. I know what I meant.
Well, when you wrote this, you did not say not pressured speech. You said in the medical record, pressured speech, right?
No.
Does it say that?
Yeah, the word is the word not is right before not, hyper, comma, pressured speech.
Right,
The two
so
are following the
comma
not.
mean to you? When you put down in a medical record, heart racing, comma, severe anxiety, comma, worried about kids, comma, baby, comma, sleep, comma, yawns but not drowsy, period. Not hyper, comma, pressured speech. That's what you wrote.
Oh my gosh.
She did not have pressured speech.
Doctor.
I wrote that, but you're misinterpreting my note.
Am I reading this correctly, and the jury will be able to look at it, that you put not hyper, comma, pressured speech?
I can tell she's ready to slap this guy. I can tell. He's paid to do this. He's paid to do it, but that doesn't mean he has to do it so damn well that every single person in the room wants to slap him.
Did I read that right?
No.
Yes, but your interpretation is incorrect.
As opposed to yours?
As opposed to you. Oh my God. How in the hell did she have the wherewithal not to slap this guy? I would have probably slapped him across the room. I would have probably made sure he had the fear of God put into him. That would have been my feel good for the day. Anyway, guys, what do you think about this whole dang demonic situation? I think she deserves to go away for a long dang time. She deserves to go away for at least the rest of her natural born life. Although, personally, I think a chair might be a great option. Oh, wait, she already got it. I'm sorry. I've been holding that one in ever since I found out that during her botched operation, she basically broke her own back. But you know, crimes against children, no matter what the heck they are, should come with a mandatory life sentence. That's my belief. Anyway, guys, God bless you. I hope you have a good night, a good day, whatever. And enjoy this primetime special of me being absolutely fed up with the medical system, the psychiatric system, everything. And just remember, all life is sacred, even after birth. Especially after birth. God bless. Take care.